guys, we're back. I'm Vaughn.
I'm Tony.
Welcome to Excuse Me Nurse. Our mission is to provide information and guidance to help promote healthcare awareness and self-care advocacy. Disclaimer, we are not doctors. This is not medical advice. We are not doctors. This is not medical advice.
We don't diagnose anything.
Today's topic, we're going to be talking about the two leading causes of kidney failure. And the one we're going to discuss today is going to be diabetes.
Diabetes is the number one reason why kidneys fail. And if you are diabetic and you already do know this, then maintaining your sugars are really good for you. Diet and exercise is helpful. If your diabetes is not controlled, then I would suggest that you keep after your doctor to help you to adjust your medication so you can maintain your blood sugar levels.
Yes.
And why does diabetes damage your kidneys is because your blood gets very thick. It's more like syrup, and it's trying to run through your body, and it goes through this little organ in the back of you that filters out everything, and it can't do it properly.
No, because the blood is way too thick.
It damages. So that's why if it's really out of control, the thicker your blood's going to be.
Yes.
So that's what causes the
and
issues.
And this is why, guys, you have to go to your annual physicals. And we're having grapes today. We don't have any pie.
No pie, that's fine. So going to your physicals every year, well, the doctor takes lab work and it tests where your kidney functions are at. So if you're starting to have issues, they can start to address that so that hopefully you will not get there and you will not be on dialysis.
And
not
you
everybody
have to
has
follow
kidney
up.
problems.
You have to follow up with the doctor. So that means if they reschedule appointments, make sure you go to all of your appointments. Make sure you're going to your physicals annually because they will draw the labs, like Tony said, and how they know how your kidneys are functioning. They're going to compare it to your previous lab. So you want to make sure you're not missing those annual physicals. Those are very important, guys, because like Tony said, you don't want to wind up with kidney failure. And once you make it to the end-stage kidney failure, there is no reversing kidney failure. So we can't slow down the progression if you know in the early stages that there is some progression. There is some things that the doctors can do. There's some medications you can take to help slow down the progression. But once you reach end stage, there is no coming back from that. And at that point, you will see me and Tony. We would love to see you, but not in that situation. So we want to try to help you guys prevent making it to the point where you have to see me and Tony.
And hopefully you like going to the doctor. If you've never been, please go.
Yes, because everybody doesn't like to go to the doctor. And we have patients that's like, well, I don't want to go. What do you tell them, Tony?
You need to go because not going doesn't change anything.
But what if I don't want to know what's going on?
Still doesn't change anything. Going and getting going in early stages is more preventative than if you know an end stage. That's like with anything, any disease or whatever. If you catch it early enough, there's usually a good prognosis that you'll be good. So you should always go. And if you don't like doctors because you don't like pharmaceuticals and you're more on the holistic side, then do holistic medicine. That's perfectly fine, but at least go and find out what's happening with you, or at least do daily checkups to stay healthy.
Yes, and if you are diagnosed with diabetes, you also want to make sure that you're doing foot checks, because foot care is very important when you are a diabetic because there is decreased sensation to the feet. So making sure that you're checking your feet regularly, making sure that when you have your nails clipped, you go to the podiatrist, because you don't want to do it at home and you risk nicking your skin or something, because you're going to heal at a very slow rate and you may not even heal at all. And then you have a skin ulcer, and then you have a skin nick, it turns into a sore, and it turns into an ulcer. Next thing you know, you're at the foot doctor.
You're
getting some amputated. You don't have a toe. Next thing you don't have a foot. So you want to prevent all of that from happening. So you want to do daily foot checks. Very important if you are a diabetic.
And when you ask questions at the doctor, make sure you understand what they're saying. And if you're not sure, ask them to explain it again.
Yes.
In English, if they say it with medical terms, or you're not sure, or take somebody with you who understands the language better or is going to ask other questions for you. We just want you to be good advocates for yourself so you stay healthy.
Yes. And our next segment will be on hypertension. So please leave your comments, questions in the comment section, and please like and follow us. And we will be addressing all questions. You know, as we become more popular, because we will become popular, we will have more questions, but we will be sure to address all of you guys' questions. So please leave questions. And no question is a dumb question. And like we said, we are not doctors. We are nurses, so this is not medical advice. If you have a serious healthcare issue going on, please go to the doctor. And until next time,
We'll see you.
we will see you. Be healthy, wealthy,
Stay well.
and prosperous.